This is Susan Merrill, one of the Associate Clerkship Directors for Medicine Student Programs at the University of Washington. I am going to review the PRIME system of evaluation and talk about how to use it to structure your brief mid-rotation and end-of-rotation feedback sessions with a medical student during a clinical rotation. PRIME is a developmental framework for evaluation of medical students in the clinical years. In the version we use here at the UW, it stands for Professionalism, Reporter, Interpreter, Manager, and Enhanced Communication. Qualities related to professionalism include compassion, responsibility, integrity, and respect for patients, colleagues, and the interprofessional team. A reporter can effectively collect data independently and report the information accurately and concisely in oral and written form. In addition to reporting skills, students at the interpreter level can generate a reasonable differential diagnosis for the patient's problems and weigh the different possibilities appropriately. In addition to reporter and interpreter skills, students functioning at the manager level can generate and carry out a reasonable diagnostic and therapeutic plan for the chief presenting problem or problems. For example, a student at this level would be able to propose an appropriate antibiotic treatment for an infection, justify why they chose that particular antibiotic, and formulate an appropriate question for the infectious disease consultant. E stands for enhanced communication. When communicating with patients, these students avoid jargon, use techniques such as teachback, and explicitly respond to patients' and family members' emotions. When communicating with colleagues and the interprofessional team, these students listen actively and encourage ideas and opinions from others, use closed-loop communication when discussing tasks, and respond appropriately to emotion in difficult interprofessional situations. I think about PRIME as a pyramid because students need a base of professionalism and reporting skills in order to become an effective interpreter and manager. Hopefully, you are already in the habit of giving brief, timely feedback on a student's clinical skills, such as soon after they see a patient and deliver an oral case presentation in clinic or in the hospital. Please also sit down briefly with your clinical student to give feedback midway through your time together and at the end of your time together at a minimum. Please use the PRIME system in these feedback sessions. Here's a suggested outline for a brief mid-rotation or end-of-rotation feedback session. I start by asking the student what they think they are doing well. I then ask them what skills they are working to improve. Next, I remind them of the PRIME system. They learn about PRIME in their orientation and on the website, and ask them what level they think they are working at most of the time. In step 4, I tell them where I think they are on the PRIME system and give examples. I then suggest 1 or 2 specific skills to work on, and we create a plan together. Please note that some of our rotations require a mid-rotation feedback form that the student is responsible for bringing to you and then turning into medicine student programs when you have completed it together. Many students have told us that they find it particularly helpful when educators give them feedback using the PRIME system. Let's hear Jacob's perspective.
In 3rd and 4th year, most of the feedback that I got for rotations was pretty much the same. It was usually, you did a good job, you're performing above what would be expected for a medical student. And then it got frustrating because a lot of times at the end of the rotation, I get a written evaluation that had very specific things that I could have been doing the whole time, and that would have improved my grade, improved my performance overall. So the good thing about the PRIME system is that it basically forces evaluators to answer the questions that medical students want to know most. And those basically are like, where am I right now? Where could I be by the end of this rotation? And what are a couple of very specific things that I need to do in order to get to that point?
In all internal medicine rotations at the University of Washington, we ask you as an educator to use the PRIME system when recommending a clinical grade. Students must be reliably at the reporter level in order to pass a rotation. They must be at the interpreter level for a high pass grade. In order to get an honors grade, students must be at the manager level with excellent professionalism and enhanced communication. Note that professionalism and enhanced communication are necessary but not sufficient for an honors grade. A student should be at a level consistently to be given the clinical grade associated with that level. Lastly, please also use the PRIME system in your written comments when you fill out your online evaluation. Here, the recommended grade was high pass, and here's what the faculty member wrote about the student. Note that she used PRIME language throughout the comment. Jane, our team was very impressed with your outstanding reporting and interpreting skills. The next step for you is to become a manager, which you were very steadily working toward. I especially appreciated the mornings when your plan would state what the issue was and how you were going to figure out what to do next. Keep this up consistently, either the plan or how you'll get to the plan, and you'll be there. In summary, UW Medicine Student Programs uses a system called PRIME for feedback and evaluation of medical students in clinical rotations. As a reminder, PRIME stands for Professionalism, Reporter, Interpreter, Manager, and Enhanced Communication. When teaching students in internal medicine clinical rotations, please use this system when giving feedback, recommending a final grade, and in your written comments. If you have any questions about feedback and evaluation of UW internal medicine students, please contact the site director for your rotation or use the general contact information here for our office, and we will direct your question to the appropriate person. We also have more faculty development materials on our website, including a one-page handout about giving feedback using the PRIME system. Thank you very much for your attention and for your dedication to medical education.